So my ladies, let's talk about UTI. What is UTI? UTI is urinary tract infection. So this is very common in women. UTI is when a harmful bacteria called Escherichia coli, that's E. coli for short, enters the urinary system. What's the urinary system? That's the bladder, the kidney, the ureters, and the ureter. UTI is very common in women. Men can have UTI as well. Children can have UTI, but it is more common in women. I think about 60% of women have UTIs. The signs and symptoms of this UTI. First of all, when you have a burning sensation down there, you want to pee and you're having this burning sensation as though there's pepper or you have injury or something there. After urinating or your bladder is empty, you still have this urge to pee as though you have not finished peeing, there's still something remaining there. That is a sign. When there's this oddly fishy foul smell, you can perceive that there's a very bad odor coming out from the vagina. It's foul smelling urine, or it's cloudy or bloody. If you see blood in your urine, you need to test for UTI. What could cause UTI? First of all, bad hygiene. If you have a very poor hygiene, you are prone to UTI. If after sexual intercourse you do not not peeing after sexual intercourse will expose you to UTI. Holding urine for too long. Hydration. If you don't take water often and you're always dehydrated, it can expose you to UTI. Then there are certain medical conditions that can expose you to UTI, such as kidney stones or diabetes. So who is at risk? Generally, being a woman puts you at risk of UTI. Pregnant women also are at risk of developing UTI. People that have catheter in, the signs of UTI, or if you have UTI, you need to treat this ASAP because you are at risk of developing kidney issues. Because when the infection goes to the kidney, it can cause kidney failures or whatever kidney issue. Sepsis is when the infection now from the bladder has gotten to the blood. It can cause sepsis, and that's a very serious situation. And also for pregnant women, if you have UTI, it's best to treat it so it doesn't affect the child in utero, because it can lead to several medical conditions for the baby as well. How to prevent UTI? You need to take water, ensure you're hydrated, drink enough water all the time. Then do not hold in your urine. When you feel the pressure, the sensation that you want to pee, go to the toilet. Treat all UTIs. Avoid douching. Some people, when they want to wash, they will put their hand inside the vagina with soap. They will use soap and wash the vagina. The vagina is self-cleansing. It does not need